This cancer expert treated his own incurable brain cancer and is now cancer-free.
This is actually a rather insane story about a physician who's a pathologist who then decides to cure his own glioblastoma. In the cancer world, we've actually made a lot of progress curing different cancers, or at least stabilizing cancers. However, brain cancers or central nervous system cancers, we have not had much luck with whatsoever. So this is why this story is actually pretty cool to hear about. To be fair, some brain cancers do have a good treatment. So meningiomas, sometimes all you need is surgery and they don't come back for 10, 20 years. However, glioblastomas, like this doctor mentioned, are some of the most aggressive forms of cancer. People usually die within a year of being diagnosed, even with treatment. You've definitely heard about chemotherapy, but most people have not heard about immunotherapy. And immunotherapy is interesting because it recruits your own immune system to fight the cancer. So theoretically, you should have less side effects than chemotherapy. In reality, you still have side effects, but again, usually they're not as bad as chemotherapy. In fact, if you supercharge your immune system, you might run the risk of your own immune system attacking your body. You might then have autoimmune thyroid issues or colon issues and so on. But again, the reward here is you're fighting off a cancer that's very aggressive. And even if your thyroid gets damaged and you need thyroid supplements, well, so be it. That's a pill you might have to take for the next 10 years, but your cancer is cured. The other challenge is getting any sort of medication to your brain. There's something called the blood-brain barrier, which makes it very difficult for most medications to actually enter your brain and to treat whatever problem you're trying to treat. That usually involves some level of biomedical engineering where you can actually formulate the drug so that when it's delivered to your brain, it doesn't get broken apart or it doesn't get rejected. It's able to actually enter your brain and treat whatever it's trying to treat. So this particular doctor was using some form of immunotherapy, which is already available widely to the public for other types of cancers. It might just not be as recommended for this particular type of glioblastoma. Perhaps if it was someone else, it might not have worked. So some of this is an element of luck, or more likely, when we figure out how genes work in the cancer world a little bit better, we'll figure out, well, if this person has this gene turned off, then they're more likely to respond to this immunotherapy. But if they have this gene turned on, then they're not as likely to respond to this immunotherapy. That is the world of oncology. That is the world that cancer is going to be in, is personalized medicine. And then you figure out which exact immunotherapy or chemotherapy will work for you.